I have the honor of introducing our next speaker, Dr. Jeanie Cote. She is a lifelong resident of Michigan, completing her undergraduate studies at Michigan State University in nutritional sciences. She then went on to medical school at Wayne State and then her neurology residency at the University of Michigan, where she was chief resident. She stayed on in the fellowship there in multiple sclerosis and neuroimmunology, and then spent several years there on staff with the faculty attending for the care of MS patients at their MS center. She then transitioned to the Memorial Healthcare Institute for neuroscience and multiple sclerosis at Owasso, Michigan in 2019. She has specialty interest in pregnancy planning, prenatal and postnatal care for women with MS, as well as an interest in lifestyle and weight management as it relates to neurologic disorders. She also holds certification in medical acupuncture. So Dr. Cote will discuss the benefits of acupuncture for MS. Dr. Cote, we thank you for your involvement in our community today. Thank you.
Yeah, I am super excited to be here today. So thank you for having me. And I am happy to talk about this topic. So after my training ended, I was sort of like, what do I do next? Am I just supposed to work every day? And I thought, well, what else can I learn? And at the time at U of M, we had this wonderful acupuncturist neurologist. And I thought, well, gosh, that's really interesting. I spent some time with him and asked U of M if they would support my pursuit of getting certified in this. And so they said, sure. And that really started my path down learning more about acupuncture and how to incorporate that into practice. So hopefully this will give some good information. Betsy is a tough act to follow. I loved Betsy's lecture. I'm so excited to incorporate music therapy to this, but maybe this will kind of perk some interest in people as well. So we'll start with just what is acupuncture, and it depends a little bit on who you ask. So there are sort of three schools of thought, and the first one I pulled from wikipedia.com. And they say it's a pseudoscience and the theories and practices are not based on scientific knowledge and it's characterized as quackery. So that is sort of one school of thought. And I think I can see that sometimes with patients when they come in to ask about acupuncture, and you can tell they're very nervous, like, am I going to roll my eyes or yell or be upset or, dismiss that as a sincere question. I think the more traditional way we think about it as being part of the practice of traditional Chinese medicine. And the idea with this school of thought is that the body has thousands of acupuncture points and they're connected in these pathways or meridians. And they're all named differently and they travel in different directions, head to toe and toe up. And there's sort of these maps. And the idea is that you have qi, or this energy that's always flowing through your body in ways that should be balanced, and that contributes to health. And that if the flow of energy is blocked, then you can have health issues, pain, immobility, other disease. And that acupuncture manipulates the flow of qi, which is the QI. Qi to stimulate healing and to rebalance and to prevent and protect and heal from disease. And then the sort of third way is taking modern day scientists and saying, well, how do we really understand what is happening? Maybe it isn't totally nonsense because it has been a practice that's existed for millennia, but maybe it's not quite as simple as redirection of qi. And is there more of a biochemical or electrophysiologic basis for what's happening? And so in nowadays times, there's many studies that are really trying to answer this question and looking at a response in the body through a variety of means. And some of the working theories is by manipulating the tissues, by inserting these needles through the skin into different points in the body, can you change blood flow? And in doing so, can that promote healing? Can you cause micro tears or micro trauma that will then stimulate your body to heal and heal beyond the micro trauma to the area of damage? So we think about that sometimes with dry needling when patients have really thick muscle knots or muscle spasms, just directly putting some needles right into that to let go. And that's sort of encouraging that muscle release along with that. And then there's also a lot of studies right now looking at laboratory changes. So a whole variety of different chemical messengers in the body, and really looking to say, if we stimulate at certain points, can we measure changes with these different cellular kind of chemical signalers? And is that what's happening when patients experience benefit from acupuncture? And I always just think it's nice to know the history of kind of where things came from. I spend a lot of time with my MS patients talking about the history of MS and sort of how it's evolved diagnostically, therapeutically, what we know about natural history studies of MS. And I think if you know the longitudinal history, one, it's just really interesting, and it really gives you a good foundation of knowing where you've been and helping to understand where you need to go forward to understand or evolve something better. So briefly, this originated in China, and there are textbooks dating back to 100 BC and called the Yellow Emperor's Classic of Internal Medicine. And that's really a compendium of a lot of different kind of educational bits of knowledge that were passed down and compiled into a book. And you can actually get it on Amazon. So I put the Amazon link to that. And then the next sort of major book, and this is used in a lot of naturopathic schools and acupuncture schools as part of their literature or curriculum. And that's the Great Compendium of Acupuncture and Moxibustion. And that came out 1300 to 1600 AD, so a long time ago. So that just really, I think, speaks to how far back this practice dates. And at that point, there were 365 points used that were intended to modify the flow of qi. And by the 1950s, we actually had acupuncture institutes that were being established in China to teach this practice. In the US, it started to first be mentioned in literature in the 1800s, and there was a flurry of interest in 1972. And around this time, the Nixon effect, what had happened was, while traveling with a journalist, the journalist got sick and needed surgery, and they were able to use or provide anesthesia through acupuncture. And I think that really kind of raised some interest as to the value of what acupuncture could bring. By 1996, the needles used for acupuncture were no longer considered experimental. And then by 1997, the NIH gave its first consensus affirming effectiveness for a limited range of conditions. And that really has not been updated since the last time I checked. I think it's pausing for a moment. There we go. And so what they had said is that there are promising results that have emerged showing efficacy of acupuncture for adult postoperative and chemo, nausea, vomiting, postoperative dental pain. It could have roles in addiction, stroke rehab, headaches, cramps, muscle pain, arthritis, and that there may be value in incorporating acupuncture in the treatment of these conditions. The World Health Organization also lists indications for acupuncture. And I won't read all of this to you, but it does sort of run the gamut from, sinusitis to headaches to other areas of pain as some of the conditions that there may be value in incorporating this into treatment. So as far as what we think we know, there was a nice review that was done. This was done earlier this year, and this group, this was published in the MS and Related Disorders Journal if you want to take a look at it. It's free to read. But in essence, what they did is they went through PubMed, and this is where we keep a lot of our literature that's searchable if you're trying to learn a lot about a topic of what's been published about it. And you can search by terms. And so they put in acupuncture and MS and pulled every piece of literature up until about 6 or 7 months before they published, so September of 2021. And it ultimately pulled up 75 articles. 31 they included in their review. And to be included, they wanted a full text in English. They didn't want a reduplication. And so some of the studies or some of the reduplicated articles sort of didn't get incorporated, but at the end of it, they had 6 articles commenting on prevalence, 5 randomized controlled trials, one of which was a crossover, some animal data, some non-controlled studies, some case reports, and a case series. And they took this and tried to compile it in a way to say, collectively, do these show benefit and in what way? And one of the studies in that 31 is one that I pulled out because I do think this is one that is something that I might find valuable in the care of my own patients. So this was a very small study, 14 women, and it combined group acupuncture with group sessions about health promotion. So this was sort of both the actual treatment, but then also some educational and instructive lessons, just really focusing on health overall. And this was called the Integrating Acupuncture Within a Wellness Intervention for Women with MS. And this was just a small way of looking at that. But ultimately, the people reported that there was less self-report of fatigue, less stress, pain, depression, anxiety, and sleep interference. And part of my world, part of my job is choosing the right medications to help patients be successful. But then there's this whole host of symptoms that still need managed, and we don't always have great treatment. So anything that is, relatively safe and may have some value, no matter how conventional or unconventional it seems, I think we have to take all of these really serious and pull together whatever we can to create that perfect treatment plan individualized to each patient. So this one, I thought, this one just really spoke to me. What they also saw was more health promoting behaviors, self-efficacy for health promotion, better social functioning, and quality of life was increased. And ultimately, at the end of the day, that's what we're trying to achieve for all of our patients, but in a way that is safe and responsible. So the other things that review of those 31 articles pulled out, or their consensus statement said that acupuncture, traditional and scalp, may improve some of the symptoms of MS. And in particular, they were more apt to see some sort of documented influence over fatigue, pain, gait impairments, and bladder dysfunction. So when you see statements showing the value of acupuncture, a lot of those statements will reference back to these articles and to this review in total. So one way that we use acupuncture, in a sense, is through nerve stimulation for overactive bladder. So one of the acupuncture points, SP6, is in the lower part of the leg on the inside above the ankle. And that is one of the points that you would consider stimulating if you were trying to treat bladder symptoms. And interestingly, we will do posterior tibial nerve stimulation, accessing that point. And in essence, you're stimulating that nerve, and we would consider that electroacupuncture. And you're using that to carry a message to talk to the pelvic nerves, the sacral nerves, with the idea of it can decrease overactive bladder. So from the standpoint of, is acupuncture quackery? I think this is interesting because you might not think about this, but in essence, this is acupuncture that we are performing, for patients to help a symptom. And there is some data to back this up. And I actually have a lot of patients who do utilize this through consult with our urologists. So as far as what to expect, so in a traditional appointment setting, because there's going to be acupuncturist clinics and then medical acupuncture, and there's slight differences between these. But what to expect in a traditional experience is you'll give a history, you'll be examined, and the acupuncturist will decide through their questioning and their physical exam what the appropriate treatment would be. And that may involve not just, a traditional bedside exam, but they may look carefully at the face and the tongue, and they may palpate more different areas looking for some of the tender spots. And there's also some pulse or heart rate evaluation that can go into that as well. And then the types of treatments, needle insertion, I think is what most people think about when you think about acupuncture. Moxibustion is another practice that sometimes is utilized, and that involves burning dried herbs on the body, not damaging them, but placing that collection and burning the top in different locations as part of a traditional Chinese practice of medicine. Medical acupuncture is a little bit different. So it's sort of an adapted version of traditional Chinese medicine. And someone will come in with a medical diagnosis and we'll say, okay, well, based on this diagnosis, this is what we think we need to do to treat that symptom. So frequency is really based on what you're trying to treat. So in theory, some would say the longer the symptom has been there, you may need more sessions of treatment to start to see more response. Others might be well treated in a session or two. And as far as what to expect, so when I perform acupuncture in clinic, I do ask patients to dress in comfortable clothes because I never know where I'm going to need to put the needle. So I need to be able to get anywhere. So like tight leggings, no thank you. Loosey, blousey gaucho pants or a skirt or, sweat clothes or something that's easy to move around. Avoid an empty stomach. So you do want a little bit of food in there just so you have some nice nutrients to keep you going for the day. And you want to be well hydrated. Some medications may be held the morning of, and that really more relates to pain medicine, with the thought being you don't want to mess with that sort of opioid system if what you're trying to do is manipulate, some of those types of receptors. So if someone's on an aspirin or an anticoagulant, generally I don't need to worry about them taking that day. These needles are so tiny. Bleeding is really usually not problematic if you're careful with where you put the needles. So patients will either be seated or they'll lay on a table. We'll clean the skin and then we'll place the needles. And those may be pricked in for a split second. With pediatric acupuncture, often it's just a single poke and the needle comes out right away. You're not going to leave the needle in the kid. That could be just sort of distressing and just tricky if they're wiggly. In an adult, though, you may be able to leave it in longer, anywhere from a few minutes up to 10, 20 minutes. Some people may do longer than that. Usually I'm about a 15 to 20 minute for most cases. And then you may apply electrical stimulation to that. We call that electroacupuncture. So that is a picture of me on the left when people were practicing placing their needles. And where you'll see is 2 teeny tiny needles in my back and 2 teeny tiny needles in the backs of my knees. And that's one of the formulas that we use for treating low back pain. And then the picture on the right is not my hands and feet. I do not have that nice of toenails. But that is a colleague of mine who is showing some of the different placement of needles in the hands and feet that we'll sometimes perform. And so what might you feel? It can be a brief pinprick. You might feel nothing at all. And what I'm looking for is if people can feel we call it the daiqi. So it could be an aching pain. It might be a zip or a tingle. It might be at a different depth. So it takes a little bit of manipulating to try to find that feeling you're hunting for. And sometimes the muscle might spasm around the needle and it feels a little tight. After acupuncture, some people might feel a little drained or tired. Some people might feel really energetic. Soreness or bruising, perhaps, but these needles are so tiny, that's really usually not a typical symptom. Muscle twitches and spasms often, and sometimes people can just really feel an emotional release. They might cry after. Serious side effects are really uncommon. In theory, could a needle break? Sure. It's made of a material that makes that very unlikely. It's got wonderful flexibility. Bleeding, again, these needles are so tiny that's unlikely. Infection, they're sterile, single use, unlikely to occur. Passing out, some people are very needle phobic. So in those cases, I do ask them to lay down. And again, why you should hydrate and eat before you do it. And then puncture a vital structure. So if you don't know what you're doing and you stick a needle in a person, things can happen. If you're trained and you know anatomy, then you should have the knowledge to not have that be an issue. And so that's a picture of the needle. The needle is actually that tiny little gray piece of metal attached to the pink tip. It's so thin and flexible, it has to be housed in a plastic casing, because if you tried to poke the needle in by itself, it is so thin, it would just bend and be all loose. So you use that as a plastic guide to help keep the needle straight while you're inserting. And that just speaks to how tiny it is. So this is, if you think about an 18 gauge, that's a IV for like giving you fluids. This is equivalent to, you could put 5 acupuncture needles to equal 1 18 gauge. That is how teeny tiny they are. We talked about bleeding, usually not an issue. Infection, usually not an issue. And then syncope, listen to the patient. If they're feeling dizzy or lightheaded, I'll have them lay down or put their feet up. And usually people are most nervous the first time in the first poke, and then they see how easy it is. And they're like, oh, that's not bad at all. So if someone does ever feel like they're going to pass out or they're prone to lightheadedness, I did include a couple fun acupressure points that you can try at home. So GV26 stands for governing vessels, and that's one of those meridians or pathways in the body. And it's that point right under the nose. So if you ever feel like you're drowsy or you need to wake up or you're going to pass out, that's a good spot that you can try to apply firm pressure for a few minutes to see if that can be alerting. And so that is a picture of the meridians to give you a sense of, from a traditional Chinese medicine standpoint, where the points are sort of allotted throughout the body. And so they're running really in different directions up and down based on the actual named channel. So for nausea and vomiting, you'll often hear about a spot on your hand. So from an acupuncture standpoint, it's called pericardium 6, and C-bands take advantage of this. And so that C-band that you wear for nausea or seasickness pushes right where acupressure pericardium 6 will be. And so to find that, you're basically going down from your middle finger about 3 finger breaths. And that's going to be that spot where you can apply kind of a rolling pressure to try to help with nausea and vomiting naturally. I think another one that I use more often if I'm going to be performing acupuncture is large intestine 4 or LI4. And the thought with this is this area here is called a command point. There's a few command points where, like, if someone has a problem, you are getting those areas no matter what. And this is the command point for face and head. So for any face or head disorders, you'll find an acupuncturist will needle this area. It can also promote contractions. So in theory, you would not use this point in pregnancy. And the way to find it is you'll take the crease of one thumb, put it on the webbing of another thumb, and just roll it up. And where your kind of nail digs into, that's LI4. And that's the spot where you can apply pressure to try to treat a headache. And then another one I always like to do for fun in the office is ST36. So this spot is thought to have immune boosting properties. So every flu season, I'll walk around and offer this to anybody that wants to have it done. And the way to find this is you'll grip underneath your knee. It'll be your 4 fingers. So measurement is really proportional to your body, not the person needling you. So your 4 fingers, and kind of right under where that pinky will be, right outside the shin bone, is ST36, where you'll be able to stimulate or provide pressure for immune function. So how to find someone? The NCCAOM is a good place to look for someone who will have gone through certifications and be registered at a statewide level. So they've taken all of those steps to have a licensed practice. Most big hospitals will have someone who offers acupuncture services. You may find it in private practice clinics as well. The training is different for a physician than for a non-physician. So there's a variety of ways to sort of locate someone. But ultimately, I think the end goal is the same, which is to really promote wellness. So as far as someone an ideal candidate, I love treating MS with disease-modifying therapies when that is appropriate. I never pretend that acupuncture is a replacement for a disease-modifying therapy. I very much view this as complementary, not an alternate. So, part of it is the right treatment for your MS through a disease-modifying therapy in most cases. And then what else can we do to complement that to really just improve wellness? So, for me, there are times where I recommend it as an add-on, but not a replacement in most cases. And the idea is really incorporating all of these interventions to improve wellness and outcomes. So does insurance cover this? It depends. Actually, the Medicare Part B does cover up to 12 visits in 3 months for low back pain. And if there is documentation that people are responding, it'll cover an additional 8 sessions. So, for some insurances, for the right indications, there is access to this. And so these are some of the other plans that have some coverage. It's going to be plan specific, and you'll just have to reach out to your insurance to see. I went a little bit over on time, so I apologize, but that was the bulk of what I wanted to share. Are there any questions for me?
There are. So there were a few about how do they find a medical acupuncturist?
Mm-hmm. Yeah. So really, if you're looking in your area, I would start by looking at the largest healthcare centers first. So that would be the academic hospitals or the larger healthcare systems. They should have a search function that would let you look for that. Outside of that, it's really going to be probably word of mouth, or if someone has self-advertised. If they are a medical doctor performing acupuncture, there is about a 200-hour certification process that people have to go through. So, if they are listing that service, they should be able to tell you where they trained, when they trained, and how often they practice. But I think just like any person providing a service, there's going to be more than one way to approach it. And part of it is making sure that you connect with the person providing the care.
All right. A question about, I get scalp acupuncture and usually get relief of the symptoms, but sometimes the MS symptoms get worse. There's a theory that the symptoms may need to come out that way, but I can get confused at that point about whether I'm doing the right thing or should take a break. Could you speak to this?
My recommendations are always going to be tailored on a case-by-case basis. I will say that paradoxical reactions are not uncommon treating any health condition, where sometimes, you expect A to lead to B, and once in a while you get a C. I think for me, it's really looking at the overall trajectory. Historically, has it had value and this was a weird blip? I would probably stay the course. If it was really more than one time not the right fit, then I would say maybe it's time to change up the formula, because there's many places to stimulate and many thought processes about how to achieve some sort of desired outcome. So maybe I'd give it 1 chance or 2 chances, but if it was really not leading to overall wellness, I wouldn't hesitate to mix it up.
That's a great answer. Does it help pain?
So I think it is on a case-by-case basis. I had this case of a young woman. She did not have MS, but she was in the ER probably every couple of weeks for pain medication, and had declined walking, like did not want to walk, wanted to sit, and was in the ER constantly for pain medicine. And I'm like, let's try this. Let's see what we can do. We started doing sessions for back pain, and I kept her out of the ER for like a year. So I can't say that is, a response everybody's going to have, but in her individual case, we were able to keep her out of the ER, away from receiving, strong pain medications, and keep her up and ambulatory. And, I haven't always had that outcome with everybody, but that was one where I thought like this was really valuable for her.
Thank you. One other question, what's an MDT?
Oh, DMT. Sorry.
Oh, they said DMT. Okay.
I shouldn't have said that. Okay. DMT, disease modifying
this
therapy.
happens. Things come out of our mouth sometimes.
Yeah. You're always supposed to say it and then put the letters and then you can use the letters. So that was like presentation faux pas. So disease modifying therapies or DMTs. So that is what we call the MS medicines, like the injections, the pills, the infusions. It's a quick way to reference MS drug treatments.
Great question here. Which symptoms of MS have you seen with the best results with acupuncture, such as spasticity?
So initially I learned it for spasticity. That was the symptom I was trying to crack initially when I'm like, let's go pick up this skill set. Probably though, I've seen better benefit with non-spastic pain syndromes. So headaches, back pain, neck aches, and then some fatigue is probably where I've seen the most influence over symptoms. If someone has true significant severe spasticity, I might be going more the Botox or baclofen pump route or some other route before I would turn to acupuncture. So it's really a case-by-case basis though.
Last question. What's the difference between acupuncture versus dry needling for muscle pain and tightness? Which one seems to be beneficial for MS or disc disease pain?
So dry needling, you're putting it right where the muscle spasms are. So someone who's trained will palpate, figure out the directions and the bands of muscles involved, and then stimulate right in those muscle bellies themselves to get them to just sort of let go. So if someone says massage feels so good, but it doesn't last, that's where I like to bring in dry needling because you're getting deeper into those muscle fibers. With acupuncture, you may be stimulating nowhere near that area. So you may say that there's a point in the foot that has influence over neck pain. So we'll stimulate far away from that site. So it's, again, really tailored to the patient. If they're saying like this muscle kills me, then I'm like, let's just stick a needle in it. Whether that's, you consider that dry needling or acupuncture. But mostly the major difference is dry needling will only be in the muscles involved. Acupuncture may be more widespread in the body.
Thank you so much, Dr. Cote, for
no problem. Sorry, there's a window behind me.
And time today on your Saturday. And I know that I always enjoy acupuncture. It's just a great, like you're feeling off balance. Just somehow there's something about it that just makes me feel more balanced after it. It's usually a really good nap too.
Yes, patients often feel wonderful when I come in. I keep the lights low. I might have music on, and then we take it out, and it's like it was like a nice rest for sure.
Thank you so much. Thank you so much. Thank you, everybody, for your questions. And you have a wonderful day, Dr. Cote.
Bye, everybody.